Okay, I know. It's time, it's time. Okay, alright. Someone's having a little bit. Like maybe the camera got adjusted a little bit. Okay. Let me just get up the chat and everything. Hello there. Oh gosh. Hello. Stand by, everyone. Stand by. I'm just trying to bring up my stuff. Hi, Benny there. Maybe I should turn off this. Hi, Ma. Oh, it's so pretty. She's so pretty. Okay, so let me just make sure my chat's working. There we go. Ooh, mosquito. Sorry. Just trying to get myself organized. Okay, I think I'm ready. Okay, yeah, so you guys probably saw I posted on Facebook that we got some more results back from Starling. We got, and you guys probably all know this, but Starling's a feral cat. She's 16 months old. She's from our feral colony. She's related to Sky. We don't know how. What are you doing back there? But this is her second litter of kittens. She came in with a foot injury. We didn't know if she was pregnant, but she is pregnant. And her respiration has been high. It's pretty normal when they first come in to have elevated or increased respiration rate. So basically, they take more breaths per minute than is normal. So that's pretty normal, especially for the feral cats, just because of stress and they're in a new environment and lots of changes. But usually the respiration rate, like when they're resting, will go to normal, and they'll have periods of time where their respiration falls closer to the normal range. And I've been keeping a close eye on starlings, and it's been pretty consistently elevated. And so I just wanted to have her checked out and make sure that we could rule out any sort of heart condition or pneumonia, any of the strange things we've seen with our feral cats. And so we did some x-rays and some blood work, several tests actually. Her feline leukemia FIV test came back negative, which is great. We did a CBC, which is like a blood chemistry panel, and that came back pretty normal. It showed mild anemia, which is normal with pregnant cats. since they are diverting so many resources to their kittens, and also cats with parasites. You can see anemia as a result of both of those things, so that's not super surprising, and it's not super concerning. But this morning, Dr. Ferguson got back. We also ran a test to measure her heart enzymes, and it's not a test that is run very often for cats, and it's not something that they necessarily, it's a newer test, and it's one of those tests that's not, it's not like a lot is known about it, except that, oh my gosh, what are you doing? Why are we doing that? Okay, let's move this closer, since it's so much fun. So Dr. Ferguson got the results back this morning, and her heart enzymes are very high. So that would indicate that she likely has some sort of heart disease. But again, no one runs these tests on cats, and so there's not a lot of information available about like how pregnancy affects heart enzymes, how stress affects heart enzymes. Look at you. So we're trying to get more information. So I think there is definitely cause for concern at this point. Just the abnormality of her respiration. After being here she's been here for a week and a half now. 11 days she's been here, and she's still having pretty consistently elevated respiration. We did x-ray her lungs and her heart, and are sending those off to a specialist to see if the specialist thinks that her heart is enlarged. X-rays are not the diagnostic tool of choice. An echocardiogram would be, which is like a really precise ultrasound. Oh, get her. So, but it is possible that the radiologist, the specialist, could see that her heart is enlarged or isn't enlarged. We did see some spots in her lungs, very small spots that could be fluid or inflammation. We treated her for lungworms just in case, because lungworms can also cause that. So she's already been treated for lungworms. So basically we're gonna wait for the radiologist report on her heart, and we also did a taurine test, so we should get those results back next week. So we're gonna wait for some more information, and then consult with the cardiologist that Sky saw, and we'll see where we go from there. So heart disease is what leads up to congestive heart failure. So Sky had heart disease, and which turned into congestive heart failure. So heart disease can be managed, but at some point, the heart is under extra stress, and so it does have negative impact on her long-term prognosis if that's the case. It could still be from stress and pregnancy. We don't know. Because of what we learned with Sky, we're being extra cautious. And so we don't know, we'll have to find out if medication is warranted and if it's safe for kittens. And Dr. Ferguson warned me that the cardiologist is probably going to be very pragmatic about Starling as far as being feral and pregnant. And the challenge with Starling is that she's still quite fearful. Whereas at this stage, Sky was beginning to be more relaxed, and she was like responding to playtime, and she was further along. She was less fearful at this stage, and Starling is still quite fearful. So there's a major difference there. So once again, we find ourselves in uncharted territory. Hi, Mama. And we'll just have to figure out as we go, and as we get more information, what is the best course of action with her. So for me, it's at this, over the next couple of days, I have to try to find a balance between pushing her socialization so that we can do more tests without stressing her out as much, and so that we can do meds and things like that if we need to, and to make her more adoptable. So I have to find a balance between that and then between pushing her too far and stressing her out too much. So I think that's kind of what I'm most concerned with at this point, because she needs to make progress in her socialization in order to be happy in a home. And so I think it's important to make progress there. But I also want to keep her stress as low as possible. And the socialization process is unavoidably stressful. So we're just gonna take it day by day and try to figure out what's going on and how best to treat it, and how to give her. Her kittens are obviously developing very well because she's gained so much weight and she's eating really well, and she eats from my hand. This morning she hissed at me, which I think is actually a good thing because it means she's feeling more confident, and that's very good. I would much rather have her be hissing than have her be terrified. So I don't know. Yeah, so not the news that we were hoping for, but thanks to Sky, this sort of I knew that it was something we needed to test for because of just kind of the breathing and I learned a lot with Sky, so that has helped to know that maybe we needed to have some stuff checked out. And again, there are no cases like these. So when Dr. Ferguson, runs, we always bring her stuff that she hasn't seen before, and that when she does they have access to a huge database of, everyone else's cases and specialists and things like that, and there's never anything documented. Oh, excuse me, that's my laptop. There's never anything documented that comes anywhere near what we're dealing with here. Oh, you are wound up. You are wound up, aren't you? And so you know, as much as I would love to be able to have an answer today, we just have to be patient and persistent and advocate for Starling and push for the answers, and then make the best decision that we can once we have more information. And in the meantime, she's so much better off here, even though she's under more stress in one regard, but she's not under the stress of having to go out and find food, and she's getting really good nutrition and good rest. What's up? She's been dewormed and all of that stuff, and she doesn't have to worry about predators, so she has a lot going for her. Her foot's doing great. Her infection's gone, so a lot of positives, but uncertain long term. And you know, again, if she runs into issues during labor like Sky did, we didn't know about there. It's interesting because her heart sounds really good, and even Sky's heart sounded normal to Dr. Ferguson and the specialists. Like many people listened to her heart, and nobody could hear anything different about it. And so we went into the emergency C-section not knowing that Sky had a heart condition, and there's nothing that we can do differently if Starling runs into trouble. I mean, the choice is either everybody dies, or we put her, we do surgery, and we know it's a high risk, but that it's better than, you know, 100% certain, you know, death of mom and kittens. So it just makes it a lot more stressful for the vets and for everybody, knowing that you would normally never put a cat with a heart condition under anesthesia. You just would never do that. But we have to. The good news is we know in advance, so we will have a plan in place, and we'll make sure that we have like people on standby to catch kittens and all the stuff that we need to do to make sure that it's like as efficient and as low stress as possible if that happens, so we can be super prepared. But you know, it definitely makes things a lot. There's definitely going to be some anxiety with the humans. The humans are going to need a low stress environment after all of this, but or it could be fine. I mean, there's just no information, and this test is new and it's not done on cats, and so we don't know. Could her heart enzymes be that elevated from stress and from pregnancy? We don't know. The radiologist or the specialist at the lab didn't think that it would be that elevated just from pregnancy, but they don't see. I guarantee you this is the first heart enzyme test they've ever seen for a pregnant feral cat. I mean, I guarantee you that this is the first one they've ever gotten. So it's just there's no comparison, and there's no way to know. And so we just have to get more information and try to figure out what's going on. So I talked to Dr. Margiocco, who's the cardiologist, when we were going through the Sky situation, and he said that yes, there is possibly a hereditary component, and that sometime between a year and 18 months they could do an echocardiogram for some peace of mind, and so all of the St. Kittens adopters are aware of that is something that they may want to do, and that it is a possibility that it's hereditary. We don't know. And those kittens were raised with excellent nutrition and parasite control, and they didn't go through the stresses that Starling and Sky went through. And they've had proper nutrition and everything, so that's a pretty significant difference. But again, there's not a lot of data available. So yes, if she has a C-section, she will be spayed at the same time, for sure, because we won't want to put her under again. If she doesn't have a C-section, we'll have to work with the cardiologist to figure out the best way to do that, or if we it depends. I honestly don't know the answer to that question at this point, but we definitely will figure that out once we know more. So it's a good thing she's here, and you guys are so cute. It's a good thing we have these guys to give us some adorableness. We will be starting the specialist and testing and all of that stuff, that cycle again, with Starling, so it is going to be expensive. The specialist at the lab was sort of like Dr. Ferguson was, we had to talk about if I wanted to take her to the cardiologist like today. So I think the levels were significantly elevated enough to cause concern that there could be an incident at any time. So I need to be prepared for that. But again, we just don't know. So if you would like to donate, you can go to tinykittens.com/donate, and we would very much appreciate it. So, because we've already run quite a few tests, and we'll be seeing specialists and consulting with more specialists. So, so that's the scoop. It's not the best possible news, but and we don't have all the information. It's always hard not having all the information. So Starling right now, I'm just looking at her. Let me count her. So if you want to check Starling's respiration, it's basically how many breaths she takes per minute. And I would like her to be like in the low 30s or lower, 36 or lower. Like if you can count Felicity's, although she's purring, so it's not really the same. But like if she's sleeping at some point and you count her respiration, she has normal respiration. So it looks like Starling's sort of sleeping right now. So I usually count for like 30 seconds unless she is unless it's like changing a lot, and then I may do a full minute, but whoops, let's see. So let's see. I'm looking at her on the camera. I'm gonna wait till it's at 15. 2, 3, 4. It's pretty good right now. 7, 8, 9, 10, 12, 13. So it's pretty good right now. It's at about 44. So that's kind of in the lowest range that it's been. She was down in 30s for a bit yesterday. It has gotten a bit better than when she got here, so I'm certain that it is exacerbated by her stress, but she's in a good sleep right now. I would like it to be lower than that when she's sleeping. And it's not been super hot in there because I've had the air conditioner on every day, so it hasn't gotten hot. So I would say that this is not related to heat. Yeah, so 20s are really good, 30s are okay. You know, it depends on the cat. Some cats just are naturally going to breathe faster, and that's fine. But, so she's breathing really well right now. One good thing about the air conditioner in that room being so loud is that it masks, like, me talking and some of the other noises, so I think she's able to rest a bit better. Your mama is a goof. She's such a goof. So anyway, so that's the news there. And then these guys are gonna go in this afternoon for some more x-rays. We're gonna get repeat x-rays. Aren't you cute? And we'll see. I'm not concerned about these guys. It's more of curiosity and just to check things out, because Keiko is a little bit flat-chested, I think, which means her rib cage is kind of like, instead of a normal cat's rib cage will be like this, hers is a little more like this. And so, but I think it's pretty mild. But sometimes you'll see her breathing funny. There's a fruit fly. And then they had little, like, strange little bends in their tracheas when they were tiny. But again, like, people don't x-ray tiny cats, so there's not a lot of comparison out there. Like, what does a normal kitten trachea look like? Well, you know, there are some pictures, but you don't know, like, I don't know that enough x-rays have been done to say what's completely normal and what's not normal. And potentially being Bengals, they might have different characteristics. I don't know. So we're just gonna check that out and make sure there's nothing going on there. Oh, look at the sweet little angels right now. So exhausted. What is your mama doing? Oh, she's having a wild time. It's hard to get sleep when your mama's partying like a wild woman. It wasn't me, Felix. Felix is saying, "Oh, don't stand on my laptop." Oh my god. Yeah, I will try to take pictures, or I'll try to get them to send me the x-rays. I didn't think to get Starling's, but I'll see if I can get hers too. I think they have them in the system. You are so funny. Look at her. Oh, get it. Get it. She's hilarious. Yeah, flat-chested kitten syndrome can be a big deal, but I would say that Keiko's is so mild that she will probably grow out of it on her own. But that's one of the reasons that I'm taking them in, just to see if they have any ideas about helping her grow out of it. It is hard to get asleep with all this racket going on, isn't it? It is. Oh, it's moving. What are you going to do? She's purring so loud as she tries to kill the scratching post. What if we put the tent on the scratching post? There we go. She is so silly. Now you can sleep for 5 minutes. I'll leave the door cracked a little bit so that she can run around in the house. Oh my gosh, you hear her. She's so funny. So that's the scoop on everybody. Oh, get her. You guys are going to go on an adventure. I haven't decided. I'm not sure if I'm going to bring her along to the vet. Hi. She was not impressed with me stealing her kittens last time, but I think Gwen will be here and maybe Gwen can entertain her for a while. He's so sleepy. He's so sleepy. She was not impressed when I took them to the vet. They were just teeny tiny then. But, oh sorry, I didn't mean to wake you up. I'm worse than your mama. But you're so cute. She was not impressed when we were like examining them, and anytime she hears them squeak, you know, she wants to like intervene immediately. So it probably would be less stressful for her to be here with the babysitter and just take the kittens, who will be 5 weeks old tomorrow. Incoming. Incoming. How's your ear? Although I could have her look at your ear. Maybe I should take you and we can look in your ear. Let me see. I know. Oh, I know, you're so cute. Oh, isn't she sweet? Oh, I should test this retest. So what other tests will have to be done for Starling? So basically, this enzyme test is not, it's not like widely used or recognized as a diagnostic tool necessarily, and it's relatively new. So like there's like a proper way to diagnose heart issues, and that would be with an echocardiogram, which is basically an ultrasound of the heart, which is Sky had a couple. She's now had several of those, but look at that. Oh no, don't leave me. I lose lap privileges if I abuse my ear rights. Yeah, so an echocardiogram would be the ideal diagnostic tool. So we have to get a referral and go through the process to see the cardiologist. And so that's what we were talking about. Do we get the ball rolling on that immediately, or do we wait a couple of days until we have an opinion from the radiologist about whether her heart appears enlarged or abnormal from the x-ray, which is again not an ideal diagnostic tool but provides, you know, additional insight. And then her taurine levels also, if we knew that going in, I think it would be helpful. And that test takes about a week to come back. So let's see, she went in on what, Wednesday was it? I think it was Wednesday, so 2 days, so probably next week we'll have that information. Starling is younger than Sky, and we know that she has eaten a lot of her food from the feeding station, which does have taurine in it. So I'm very interested to see what the results come back. It could be totally unrelated to that. It could be hereditary. We just don't know. Or again, it could be just pregnancy and stress and something. I mean, I think it's unlikely, but it's still a possibility. See, I'm cleaning your ears, but I'm pretending like we're just enjoying lap time together. Isn't that nice? Oh, she's so pretty. We did treat her for lungworms, yes. That is a possibility. We've seen lungworms in other cats. And it didn't look, the x-rays didn't look like she had necessarily fluid in her lungs. There were just a few spots that were cloudier than they could have been, which again could be nothing, or it could be something. Did I lose my lap privileges again? It's time to get some. Oh, what's this? So, but yeah, it's not going to be so the echocardiogram. So it's also going to be a challenge. The echocardiogram, normally you do that under sedation, because it's very precise, and she would need to be perfectly still. I don't have like back of the house privileges at the specialist like I do at Mountain View, so I'm not sure if they would let me back there to help restrain her. I always try to stay with them. Like when Cassidy went, I sort of, was like I try to stay with him as much as possible, just because I'm overprotective. And look, I was gonna do it again. You weren't even gonna notice. I know. Maybe I will take you. We'll have your ears checked. What's up? So anyway, it's hard because they're not used to owners coming in. And oh, here's Dr. Ferguson calling me. Let's see. Hello.
Hi, how are you?
Good, how are you? Uh-huh. Oh. Okay. Sure. Yeah, I guess we should do. Yeah. Yep. Yeah. Right. Do you think when they put in the referral, can they like say that I can help restrain her? If that, because I know they were somewhat reluctant, like with Cassidy and stuff, and like with Sky, I was like, I can do it, and they think I'm just like an owner that's gonna be like weeping all over the place. But I don't know, because I think she'll do okay, but I think that I would be helpful in keeping her. Yeah. Okay. Yeah, okay. That's good. Thank you. Yeah. Right. Not all the time anyway. Yeah. I'm at least aware of that. So, yeah. Yeah. Okay. Okay, that's fine. I know. I know. That's right. You're welcome for learning a whole new thing. Yes, I am so helpful. All right. Okay. Okay, thanks. So do you think does it usually take like a week, or it just depends totally on their schedule? Okay. Yeah. Yeah, she was just around 44. I just counted her a little bit ago. She was at 44 sleeping in like REM, so yeah. Yeah. Okay. All right, thank you so much. Okay. Bye. Okay. So, okay, so she talked to the pathologist again. Um, and that pathologist had to refer to other pathologists because, again, this is not something that people know anything about. And so they found someone finally who was aware of some cats who did have slightly elevated heart enzymes. They actually ended up going to the people who developed the test, um, and did all the research for the test, so the heart enzyme test. So um, they were aware of some cats in the first trimester of pregnancy who would have elevated heart enzymes, slightly elevated, but all of the pathologists said that it would not be that elevated. So potentially that the pregnancy accounts for some of it, but not all of it. So and you probably heard me asking Dr. Ferguson so they have to put in a referral, but to like they have to seeing if they'll give me like a reference that I'm not a crazy person and that I am actually capable of being helpful in restraining her and making her easier to do a test on unsedated. So I'm assuming I don't know when the scheduling will happen. Potentially sometime next week, and then this is for an appointment with the cardiologist to get the echocardiogram. This is good. So the way we're doing it, so with Sky, the cardiologist had been on vacation, and so because we really wanted her to get seen as quickly as possible, we didn't want to wait another week to get an appointment. So I took her to the emergency clinic, and where he does his where he is on staff, and so we were able to have her seen by him. But I didn't get to, like, they don't book a lot of time to talk to the owner. And they do that because a lot of the time, you know, if you're telling someone that their beloved pet has heart failure, and then, you know, it's like you have to answer a lot of questions, and it's a lot of time, and, you know, you kind of have to care for the humans as well, and so it's not very efficient that way. So this way we should actually get an appointment with the cardiologist, and we'll be able to get more questions answered directly instead of going through other doctors, so that's good. So, hi, you are so scampy. Come here. Yeah, wake him up. They've been sleeping too long. Wake him up. You're so cute. Oh, is that your baby? Is that your baby? Does he make a really good footrest? So anyway, interesting. So what I wonder is how much stress is playing a role too, because if the physical stress of pregnancy is capable of a slight elevation in heart enzymes, then the like psychological stress of captivity and human predator and all of that, I would imagine, is also capable of producing an elevated heart enzyme. I just don't know what is the right approach as far as trying to push her socialization so that she's less fearful, or backing off on the socialization so she's less stressed now. It's a delicate balance. You're so cute. I think I'm going to take her with me and have her ears looked at. And her eyes, maybe. I don't know. Or do you want to stay here? You don't like it when we examine your babies because they squeak, and then you want to get them, you need to clean them. Yeah, I mean, if she was a normal cat, I would totally agree that more love is better, but to her, love feels like a threat at this stage. Like, I can love her all I want to, and, you know, to her, she interprets my love as like a threat of being eaten, so stressful. She's not. But like a lot of the cats, you have to like push past that point. You have to give them the reassurance. Like, you have to push them and reassure them, and then like that gets them to the next level and makes them feel safer. But you have to push through the initial fear to get to that point. Like Bill is like that. Like, he's fearful, and then when you have him in your lap for 10 minutes, he's like purring and rolling around, but it takes him a while to get to that point. Right, Mama? You're lucky. You don't have these feral cat problems. You have backyard breeder problems, but you don't have feral cat problems. So Starling is on live stream at tinykittens.com/starling. I'm not doing the update from her room because I'm trying to keep her stress as low as possible. And I'm just like trying to be careful, monitoring how. So her breathing's good right now, like it's still high, but she's not it's not shallow, and it's slower, and she's having a good rest. So that's good because I did go in there, I don't know, was it an hour ago, a little more than an hour ago? So she has recovered. She is recovering more quickly from my visits, but I didn't do a super invasive visit. So no, we wouldn't do a C-section a week early because the kittens need all the time they can get in there, and that would be super risky for them. We would love to find her last kittens, but this doesn't, it gives us more information about her, but it doesn't give us any more information about how to get her kittens or where they are or anything like that. Her first litter. We're hoping they'll show up at the feeding station, but if we don't see them, there's nothing we can do. Starling is not sorry. Here, let me see what's going on with the VIP camera. Oh my gosh. I don't know why live stream has been throwing the weirdest errors lately. Sorry about that. Whoops. It's coming back up. Maybe I should reboot. Oh, you're so cute. Look at these adorable kittens. My battery is about to die. Can't reach. I have to move all my stuff around in here, so I can record just about. Hi, Mama. Okay, so VIP should be back up now. Okay, so yeah, so Starling having a friend. In case you didn't see how she was with Bill, she was pretty clear that she wanted him to maintain his distance. She's not social with cats at the feeding station. She was interesting because when she was little, she seemed to have a crush on Rhodes and Gallico. I think Rhodes and Gallico and Crusher were related, and she seemed to have a crush on them. She would always be rubbing against them and kind of following them around, which is unusual because even if they were her dad, which I think is possible, because we hadn't neutered them. I think that she was born early in the summer, so it could have been before we neutered them, but usually the dads don't have relationships with the kittens, so it was just kind of interesting. But everyone else, she kind of would get Porter would smack her away from the food. Macy was kind of smacked her. Sable obviously is a little bit around the food, gets a little bit feisty. So I don't think that she would necessarily want to have company in there. I think it might make it more stressful. Where are you going? You got bored with us? I don't think I have 3 exams booked today. Because I know these 2 are gonna take a while. What is your mama do? She's so noisy, isn't she? So noisy. Sometimes you just want to have a nap, and she's just so noisy. Yeah, so we don't know. Yeah, so we don't know. We don't actually have a lot of pregnant moms out there anymore. Just Macy. There's a black one that showed up a couple of times that I haven't put in the system yet, and then Macy hasn't been spayed, but it's just those 2. Macy's still nursing, so and she I think she actually will do pretty well with socialization, but I don't think she and Starling would get along. I was trying to see how they interacted together out at the feeding station, and Macy's definitely much more dominant and assertive than Starling, so I don't know that would be a good match. I think Macy and a different cat might do okay. Oh my gosh, Felicity. Oh, she's having so much fun. I can't tell what it is she's got out there. Yeah, I haven't seen Scout in a long time, actually. She's not one that ever showed up regularly. She would just come occasionally. So yeah, so Starling's gonna be interesting. So we'll see. We'll see. Yeah, I did think about putting a snuggle mama in there with Starling. I don't think that she's lonely. I think that she's still adjusting to captivity, and so it doesn't feel like she wants to go back to the forest because that's familiar and safe to her. I think that's really the biggest thing. But I did consider doing a snuggle mom to see what she also, it's interesting because she's not playful at all, and so probably just still a result of stress. Like none of the pregnant moms except Sky have been playful like during their pregnancy. None of the ferals, I don't think. Sky was. But so I think that's just another indication of fear and stress. But she eats super enthusiastically out of my hand, which is, you would expect if she was so fearful, she would not do that. So it's kind of interesting. Kind of interesting. Another unique individual from the feral colony. Yeah, she hasn't like spent a lot of time with the fern that's in there. The other ferns are in the ICU. I could bring in a few more ferns. I don't think that's going to make a huge difference for her though. Yeah, she was more confident this morning, which is good. I mean, it's only been 11 or 12 days, right? So 11 days, I guess. Um, so it's only been 11 days, so she's still adjusting and she's less confident, so it will take her longer to adjust. Like she's more fearful. But I took it as a good sign this morning that when I went in, she actually hissed at me a couple of times. Her pupils stayed pretty normal, and then she did eat out of my hand pretty quickly. So, and then her breathing went down like within an hour or so, which I think that's all of those are signs of improvement.
No, can you stop stepping on my laptop? You're not allowed to email just yet. You silly.
Yeah, I don't know about the catio either because all the cats we've let out there, it sort of keeps them linked to their feralness, and if she's going to have issues, socialization is going to be really important. And then also there are humans out there, and the office next door did some construction and has a deck out there, so they eat lunch out there, and so there's a lot of human noise, like talking and laughing. That's pretty close. So, and plus it's hot, so I can't have the window open at this, like during these hot days. I don't know. I don't know. All good questions. All good questions. You're so cute. Aren't you cute?
Oh, you're so cute. I can't bring you in with dirty ears. This one looks okay. That looks like normal. Just this one looks a little bit. Not that there's anything that...
She's being treated with everything she can be treated with right now, so it's not like there's nothing that, there's nothing they're gonna say different than what I'm already doing, but
Look how cute you are. Look how cute you are.
I don't know.
You're so cute. Look how many Q-tips I have. I have so many. Remember when there was a Q-tip shortage here? You're lucky that you weren't here during that. I mean, you're wishing you were here during that. Where are you going? Oh, she says, stop it. Stop it, lady. So annoying. It's so annoying. It's so annoying when you just want snuggles and someone just keeps, like, doing stuff to your ear. I know, I'm so annoying. I don't know, maybe I will take you just for a quick peek. Just for a quick peek. We can see if there's anything else going on in there. Right? Well, look, while you're here, you know what else I can clean on you? This is like, this is like sort of, I feel like, karma for you, because what do you do to your kittens all the time? Like when they just want to snuggle and you have to clean them. Look, I'm like you and you're like Keiko. That's right, but I don't chew your whiskers off. So see, perhaps that we can just, you know, put things in perspective here. Right? Oh, she's so cute. She's so cute. Oh, it's very cute. Where are you going? Oh, you're so cute, aren't you? Alright, so not too much time. No, I'm letting you keep your whiskers, so you're welcome. You're welcome. Oh, Keiko's. Oh. I can't tell if she's sleeping. I think she's sleeping. She's sleep nursing and had like a stretch. Oh my gosh, it's so cute. So cute. Okay. Yeah, no, there are no whiskers. I think there's like one really sad looking whisker left on one of these two. They do have their eyebrows though. They have nice eyebrows. No whiskers. Okay, so I'm gonna get ready for our appointment. Aren't you cute? Are you just so cute? I should trim your nails. That's what I should do. I should trim their nails too. We should do nail trims. I wonder where. Oh, I'm gonna put the air conditioner back on. I just turned it off for the update. Okay. You're so cute. Will you let me do your toenails? A little bit. Oh, good girl. Oh. Do you think I'm so annoying? Okay, let's sit down on this. Oh, she's so cute. Good job. You're a good girl, aren't you? You're so pretty. So pretty. Oh, where are you going? If you behave yourself, maybe Dr. Henderson will adopt you. Probably not, though. He's happy to keep her for their little single friend. I think one day was enough for her. Let's see, wait, we've got 2 more to do. 2 more, 1 more. Perfect. Good job. Such a good girl. Should we trim the baby's nails? Okay.